Hello everyone and welcome to Short News Channel. So let's be in the district movement in the state is suspended for 15 days from May 21st. The state government today issued an order suspending all inter-district transport services and movement of people for 15 days with effect from 5 a.m. of 21st in order to control the spread of COVID-19. However, the order said that there would be certain exceptions which include movement of goods and persons, including frontline workers in connection with COVID-19 related duties on production of valid documents and movement of officials and persons, both government and private, involved in emergency services such as prisons, home guards, fire and emergency services, electricity, water and sanitation. Other exemptions include judicial officers, officials of courts of Assam on production of valid identity card, movement of pregnant women and patients for getting medical services, movement of persons coming from and going to airports, railway stations, ISBTs on production of valid ticket. Chief Minister Dr. Himanta Biswa Sarma said that patients are putting their lives at risk by not following home isolation SOP rules. The Chief Minister admitted that the death rate in the second wave is higher than the first wave and said that several factors can be attributed to that. He pointed out that the mutant virus seemed deadlier and there have been a number of instances where patients died within 2 to 3 hours of reaching hospital, which gave very little time to the doctors to treat them. The second major cause, according to Sharma, is that a substantial number of patients are not following the home isolation SOP strictly. They are not following the SOP issued by the government. He said that as per the SOP, the patients in home isolation should regularly check the oxygen saturation level and they should immediately report to hospitals or COVID care centers whenever the oxygen level drops below 92. But there have been a number of cases where people came to hospitals with 70% oxygen saturation level or even less. It is very difficult for the doctors to revive them. He appealed to all the infected persons who opted for home isolation not to risk their lives by not following the guidelines. Highest single-day COVID cases in the state. On May 11, 85 people had died due to the infection, which was the highest till yesterday. The state also saw the highest single-day spike of cases with 6,394 new infections reported during the day. However, the number of tests conducted was also high. The positivity was, however, a little on the lower side at 6.99%. Cases in Kamrup Metro appeared to be stabilizing at around the 1,000 mark. Today, the district saw 1,100 new cases. Chief Minister Conrad Sangma said that a possibility of 10,000 active cases are there in Meghalaya. He said the state is looking at the possibility of having 10,000 active cases and therefore the government is accordingly working to ramp up infrastructure and manpower. Sangma said that the government had anticipated 5,000 active cases and therefore put in restrictions to slow down the spread of the virus and during that time worked hard to ramp up the infrastructure. We may even go to 10,000 and so we are continuing to ramp up oxygen and beds availability. He said, adding that people are being urged to follow protocols to slow down the spread of the virus. We are looking at a tough situation in the next few weeks. He said that currently the state government has almost installed 750 hospital beds with adequate supply of oxygen. We have now 1,500 oxygen cylinders in the state. The state has spent close to rupees 400 crore so far, which is less than what was spent last year to fight the pandemic. He said that several COVID hospitals and centers are coming up across the state, especially in the district headquarters, and also oxygen generators are being installed in some of these districts to fight all scenarios. He urged all political parties not to find faults with the government at this critical juncture and instead work together to fight the pandemic. He further informed that vaccination is one of the important strategies to fight the pandemic. Sangma said he had a discussion with the Union Health Minister and urged him to help supply vaccines to Meghalaya, which has a small population. The state requires 30 lakh vaccines for the 18 to 44 age category, and so far only 42,000 vaccines have been received so far. However, he expressed confidence that some of the companies would be able to manufacture 15 crore vaccines in a month in the next few weeks, and this would go a long way in the vaccination process in the state and the country. That's all for now, friends.